Hello guys, today's topic is cranial nerve palsies, and if you look at my screen here, these are the major nerves I'll be talking about today: the right third cranial nerve, fourth, and then the sixth one here. So just remember, the third one is known as oculomotor nerve, fourth one is known as trochlear, and the sixth cranial nerve is known as the abducens. So we're going to start with a mnemonic that I learned in medical school. It's LR6 and SO4. So LR6 means lateral rectus is supplied by the sixth cranial nerve. And SO4 stands for superior oblique muscle, which is supplied by the fourth cranial nerve. So let's start with the sixth cranial nerve, because in my opinion, that's the easiest one to remember. When the person comes into your exam room and is looking forward, so remember this middle slide or the middle pictures are all when the person is looking forward. Then this slide is, or this area is when they're looking this way and then looking that way. So just for keeping it simpler, we're talking about the right nerve palsies in all these three scenarios. So if you start with the sixth nerve, when the person is looking straight ahead, which is right there, looking forward, the right eye turns medially. Medially means towards the nose, and laterally means away from the nose. So let's say this eye is the one which has the problem with the sixth cranial nerve. So when you ask them to look straight ahead, this eye obviously, which is the left eye, is normal because it doesn't have any palsy with the nerve, but this eye, the right eye, has the sixth cranial nerve palsy, and therefore is not going to look straight ahead. It's going to look a little bit towards the nasal side, which means the right eye turns medially, and immediately you know, oh, okay, so there's some nerve palsy. So we do the EOM, which is extraocular muscle movement test with the pen light, and we ask the patient to look up, they will be fine, look down, they'll be fine, look towards the right side and look towards the left side. So when you ask them to look this way, which is right here, ask them looking, you see the arrow? It says here that the patient is able to adduct right eye, no obvious squint. What does that mean? Okay, so looking towards the nose is known as adduction, and looking away from the nose is known as abduction. So if you ask the person to look this way, remember this nerve is the palsy one, or this eye is the one with the sixth nerve palsy. So technically they're supposed to look, they should have a problem looking this way. But if you ask them to look that way, they'll be able to look fine, because it's the problem with the abduction, which is away from the nose. So if you look at this scenario, which is asking the patient to look on the other direction, in this situation, because the eye has a palsy and it's the lateral rectus, which is supplied by the sixth cranial nerve, this eye won't be able to look this way. So they're going to keep looking straight ahead. The other eye obviously is going to be fine. So it says here, unable to abduct the right eye, larger angle of squint, and double vision further apart. So this is going to cause a squint and also double vision. So just remember, just to recap, I know the cranial nerves are a little bit difficult to understand, but just remember, lateral rectus supplies or is supplied by the sixth cranial nerve, which causes the eye to abduct or move away from the nose, okay? So in this case, when you ask them to look away from the nose on this side, the person is unable to do that. If you ask them to look straight ahead, the eye immediately moves a little bit towards the nose. And if you ask them to look in the direction on this side, obviously this eye is going to do that, because the lateral rectus does not cause problems with adduction, is supposed to cause abduction, not problems with adduction. Then we come to so lateral rectus is supplied by the sixth cranial nerve, superior oblique is supplied by the fourth cranial nerve, and all the rest of the eye muscles are supplied by the third cranial nerve. So if we focus on the fourth cranial nerve, it supplies the superior oblique muscle. Superior oblique causes the eye to go down. So when they are looking straight forward, of course the eye is not looking down, it's going to go up. And you see here, right eye turns upwards and outwards a little bit. So that's because of the superior oblique muscle palsy with the fourth cranial nerve issues. And the right eye elevates more as it moves medially, double vision further apart, is when you ask them to look on this direction, it also moves a little bit up. And then if you ask them to move in the right direction, no obvious squint is found, because again, it's just fourth cranial nerve is causing superior oblique muscle to function well. Superior oblique muscle has no problem looking on this side, which is the right side. So it's always with the looking straight forward and then looking towards the left side if the right eye has the issue. Then we come to the third cranial nerve, which is known as the oculomotor nerve. So the rest of the muscles are supplied by this nerve, and you ask them to look forward. Basically, this nerve is causing us to adduct, which means looking towards the nose. But in this situation, when they're looking forward, it's not, the nerve palsy is obviously unable to move the eye towards the nose, and therefore the eye turns outwards a little bit, and it says your right eye turns downward and outward. In this situation, when you ask them to look towards the left, again, this eye is supposed to technically, the muscle that's technically supposed to be looking towards the nose, remember the nose is here in the middle. So if this eye is supposed to be looking towards the nose, it doesn't because of the third nerve palsy. It cannot adduct meaning towards the nose, and therefore it goes outwards. So here it is, unable to adduct the right eye, larger angle of squint, double vision further apart. So there will be double vision here. And then if you ask this same person to look towards the right, again, the right issue is not going to be there because there will be a smaller angle of horizontal squint, because again, this muscle that makes the eye look towards the nose is adduction, and that's the issue with this. But we're not asking them to look towards the nose. This time we're asking them to look away from the nose. So this eye obviously is the normal eye. It does look away easily. And this eye, which is supplied by the lateral rectus muscle, the sixth cranial nerve, causes the eye to abduct. It's going to abduct fine because the third nerve palsy is apparently in this eye. It's the only issue. When they are looking towards the nose, it moves out. Or when they're looking forward, it moves out a little bit also. It moves out more in this situation, and therefore, like asking them to look towards their nose, obviously there's a palsy in this eye, and therefore the eye moves outwards. There will be double vision in this scenario right there, not double vision in this scenario, because you're not asking them to do that movement that requires the muscle or the nerve to start getting activated. In this situation, we're asking them to look away from the nose, and therefore we should not have any issue there, but maybe a smaller angle of horizontal squint could be present there. So